Alcohol can damage the liver cells, and with chronic alcohol use, the liver cells die, and every time a liver cell dies, it deposits some scar tissue in the liver. And with time, the whole liver can be replaced with scar tissue. That's when you call it progressed to cirrhosis. Alcoholic liver disease can include one of three things. The first thing is fatty liver disease. The second, and a serious complication, is called alcoholic hepatitis. In alcoholic hepatitis, patients can get acutely jaundiced, so they can turn yellow, and they can also develop fluid buildup in the legs, fluid buildup in the abdomen, and all complications similar to cirrhosis. The good thing about alcoholic hepatitis is if they quit alcohol, then probably 2 out of 3 people can reverse from this, and the liver can get back to a normal functioning level. The third disease that can happen from alcohol is cirrhosis, and this happens with chronic drinking over a period of time. And with cirrhosis, patient can develop all the complications related to cirrhosis, like fluid buildup in the legs, fluid buildup in the abdomen, confusion, jaundice, itching, bleeding, all complications that can happen with cirrhosis. With alcoholic cirrhosis, some of it may improve if they quit alcohol, but most of the patients may end up needing a transplant as the curative option. In general, for women, if they drink more than 1 drink a day, they're at risk for having cirrhosis eventually, or alcohol-related complications. For men, more than 2 drinks a day can lead to cirrhosis or alcohol-related complications. Also, not every person who drinks alcohol will get cirrhosis, so there is some genetic factors that we don't know of that make some people more prone for liver disease than others. If you suspect that you may have alcohol-related injury, you could see a gastroenterology specialist or a GI specialist or a liver specialist to see how much damage you may have to your liver, so they can do some tests. The tests that could be done to see if you have damage to the liver from alcohol are blood tests and an ultrasound scan. There's a newer scan that's called FibroScan, which is an ultrasound technology, but what they do is they send sound waves in there and see how fast they're coming back. Depending on how stiff the liver is, the speed is different, and it can tell you how much scar tissue there is in the liver. Alcohol-related liver disease can be reversed if it's not to the advanced stages. If you quit alcohol completely, then the liver can recover mostly within the first 6 months, but up to a couple of years. For patients with advanced cirrhosis, if they don't recover after they quit alcohol, then they would need liver transplant to cure the cirrhosis. And obviously after transplant, they cannot go back to drinking because the new liver can get equally damaged, and indeed it's more susceptible to damage from alcohol than their previous liver was.